This week on Health Garage.
The higher the slices a CT scan has, the better resolution, the more accurate the images are, the more precise the images are. So each body part can go through different applications and we get the specific information we are looking for depending on the clinical condition of the patient.
Welcome to Health Garage. Today, we are diving into the world of medical imaging, exploring the transformative power of CT scans in solving medical mysteries. Join us as we uncover the benefits, applications, and cutting-edge advancements in CT scan technology with an expert from Uganda Martyrs Hospital Lubaga. Welcome to the show, Doctor, and kindly introduce yourself.
My name is Dr. Milka Hapte. I'm a radiologist at Lubaga Hospital. I also head the radiology department at the hospital. Computer tomography is commonly known as CT scan. It uses X-ray and computer system to create images of different body parts, to create cross-sectional images of different body parts, and help clinicians reach a diagnosis and help them in treatment and follow-up of different diseases. CT scan can create images of different body parts from the head to the toe. It has applications that create images for the head, the neck, the chest, the abdomen, the pelvic cavity, and all the extremities. And within these body parts, we can do numerous investigations, CT investigations. Let's say in the head, we can just do imaging of the brain, different parts of the brain. We can also go ahead just to look at the vessels of the brain and diagnose different diseases. We can diagnose aneurysm and other AV malformations and other conditions affecting the vessels. The same holds true in the rest of the body parts. Say in the chest, we can just look at the lungs in high resolution images. We can also look at the vessels of the lungs and diagnose clots in the vessels. In the abdomen as well, different types of investigations. We can just look at the solid organs like the liver, or we can look at the vessels. So each body part can go through different applications and we get the specific information we are looking for depending on the clinical condition of the patient. CT scans are different depending on the capacity of imaging they do. So we usually look at their slices. The higher the slices a CT scan has, the better resolution, the more accurate the images are, the more precise the images are. And the CT scans that have higher slices helps the radiologists and other clinicians to reach accurate and precise diagnosis. So the differences come about depending on the capacity they're able, the CT scans, the different CT scanners are able to perform. Commonly, as I mentioned earlier, we use X-rays and a computer system to generate CT images. If we look at the conventional X-ray, the typical X-ray examination we do in a hospital, it's very useful, but with some limitations. It may not give us the information, the detailed information we are looking at. Whereas a CT scan, it uses X-ray, yes, but it doesn't use one beam as we do it in the conventional X-ray. The X-rays come in a circle, and they're imposed on different body parts and give us detailed information of the body part in slices. The thinner the slices are, the more information and the more detail we get from the images. Whereas in conventional X-ray, we just look at, okay, it gives us information, yes, it also helps us in diagnosing so many diseases, but it doesn't have the details we need to have to reach an accurate and precise diagnosis. Such a CT scan is very useful, especially in this era where non-communicable diseases are very common, like cancer, cardiovascular diseases. It helps us locate the exact location or origin of the disease or a tumor, and it also helps us in staging that disease. And after treatment, we also use it to make a follow-up on the patient, so it has several advantages. CT scan, as I mentioned earlier, uses X-ray. It uses radiation, and radiation has risks. Though the benefit is always, almost always outweighs the risk, we also have to be cautious on how to use this X-ray emitting imaging modality. It should be recommended by a clinician. A patient should come with a legal request form from a certified clinician. That's when we go ahead and do CT scan. We also have to make sure the patient doesn't have a high risk to the investigation. We use contrast media. It's a pharmaceutical substance which helps us make our images clearer. So we make sure that the patient is not allergic to that dye, or we call it contrast media. So before we go ahead and do the CT, there is a checklist we go through. We make sure the patient doesn't have a high risk of reacting to the contrast media. We also make sure the patient is not pregnant. If she is, and she has to do the scan, there are precautions we take so that we protect the unborn fetus. So in conclusion, a CT scan is preferably to be recommended by a certified clinician, and we also do our assessment and go ahead with the scanning. Just like any other technology, we have evolving technologies in CT scanners. We are able to do so many investigations which were not very clear in the past. We're able to do different investigations of the vessels in all parts of the body, and because of the evolving technologies, the images are much more clearer, and the radiologist is also able to reach an accurate diagnosis because of the clarity and the resolution of the images produced by the scanners. Currently, we have a CT scanner which we've used since 2016. It's a 6-slice CT scanner. Yes, it does the basics, the basic investigations, but because of the thick slices it produces, and because it's a bit slow, it's not able to give us the clearest images. So it can also hinder us to reach the accurate diagnosis and make the right decision. So we are looking for a better CT scanner, which will give us much better resolution and helps us reach accurate diagnosis. Lubaga Hospital is expanding, introducing so many subspecialties which need to be supported by diagnostic imaging, by radiology. In order to do that, we need the latest technology and helps this specialties, subspecialties reach the accurate diagnosis and helps them in decision making. Currently, we receive around 15 patients per day, but also we refer around 5 to 6 patients per day. So this, once we get a better CT scanner, we will be able to do those investigations we are not able to do with the current CT scanner. So it's really important to get the best technology there is and support the different specialties in the hospital, and also minimize the referrals we've been doing in the last several years. It's true, CT scanners use X-rays to create images. However, the X-ray dose, the radiation dose that is received once during that investigation will not cause cancer. It's the cumulative radiation doses that may cause cancer. Because someone has done CT scan once or twice, that will never cause cancer on patients. Rather, it will help someone, if someone has a cancer, it will help them diagnose and make the right decision at the right time and get the proper treatment at the right time. When someone goes through a CT scanner, the procedure is not painful. However, we make the patients prepare for the circumstances that the patient may have or may experience during the CT scan procedure. It's not painful at all, but we make sure, as I mentioned earlier, we make sure the patient is not allergic to the dye we use. We make sure the patient is not claustrophobic. We also calm the patient because the patient is going to be in a room most of the time alone, as the technologist watches over him through a window. So we make sure the patient knows it's not noisy, maybe some few clicks. However, it's not a noisy procedure. It's not a painful procedure. What we have to do is we make sure the patient doesn't have risk factors that may end up harming him or her. So we go through a checklist and make sure the patient comes out of the CT scan procedure safe. Normally, once a patient has underwent a CT scan procedure, they go back home. But we also instruct them before they go back home. We make sure they stay around the hospital near the radiology department for an hour or two in case they have some mild symptoms like itching or vomiting or nausea or dizziness. So we make sure the patient doesn't have that because they usually occur within 1-2 hours after the procedure. Then once we made sure the patient doesn't have those mild side effects or any other side effect from the contrast media, from the dye we use, we let them go home. CT scan procedures are used for emergency and non-emergency cases. Patient may have, for example, a trauma to the head and maybe bleeding inside the head. So in that case, that may be emergency, and the patient has to be brought to the radiology department for a CT scan as soon as possible. So treatment or measures are taken on time. It's also used for non-emergency cases. For example, someone who has a cancerous process that may not be an emergency. All we have to do is bring the patient as soon as possible, and we reach the accurate diagnosis and let the patient go back to the doctor and get the right treatment. It's used for all age groups. We use it in all age groups. However, we have some restrictions in using it on children, unless it's mandatory to use a CT scanner. We look for other imaging modalities for children, pediatric age group, because of the radiation indication is used in all age groups. A CT scan is done following a request from a clinician. So the CT scan investigation we do at radiology depends on the indication and the clinical condition of the patient. For example, if the patient had a trauma to the head, we just restrict the investigation to the head only. If the patient has a liver mass, we restrict to the investigation to the liver or to the surrounding abdominal structures. If the patient has pulmonary embolism, then the investigation is restricted to the chest. So the investigations we do depends on the clinical information we get from the doctor. That's why we always look for a legal request form written by a certified doctor, so that we know what to expect, and we also know how to plan the CT investigation. A CT scan investigation involves so many expensive items. The machine itself is very expensive. The technology is expensive. We also use consumables which are not cheap. We also involve highly skillful personnel, CT technologists, radiologists. So this HR are also not cheap. Once a patient is scanned, the images can come out within maybe within an hour or less than that. However, the radiologist has to sit and go through all the images of that particular patient and take his or her time, go through it, and make sure no mistake is done, and reach an accurate diagnosis. So the time that it takes a longer time because of the time we impose on the images to go through them and reach the most accurate diagnosis possible. I would like to reassure the public, CT scan is safe as long as it's recommended by a doctor, as long as it has a clinical indication and the right information from the doctor. And once the patient comes to radiology, we also have our own precautions, our own guidelines and procedures to make it as safe as possible, and patient walks out of the CT room safe. So I recommend CT scan to be done after it's indicated by a certified clinician. I call upon everyone to come and attend the fundraising dinner, which is going to be held on 17th of October in Popo Memorial. I call upon everyone to come and join us in this noble cause to get a new and better CT scanner and aid the radiology department reach an accurate diagnosis.
Thank you, Dr. Milka Hapti, for sharing your expertise in the vital role of CT scans in diagnostics. Accurate diagnosis lead to better patient outcomes, and we are committed to bringing you the latest insights. Stay tuned for more health informative content. Have questions or topic suggestions? Connect with us on our social media platforms or send us a message on the WhatsApp number on your screen. Your health matters, and we are here to illuminate the path to wellness.